everyone. We're going to talk about one of the most common post-operative complications of dental extraction, including wisdom tooth surgeries, called dry socket. Dry socket, also termed as alveolar osteitis, is a painful condition many people suffer from post-dental extraction. As soon as the tooth is removed, blood fills the socket, forming a blood clot. Dry socket occurs when this blood clot at the extraction site is dislodged prematurely, fails to develop, or dissolves before healing. Let us talk about the healing process to understand what exactly happens. On the day of the extraction, the tooth is removed under all aseptic conditions using local anesthesia. As soon as the tooth is removed, blood fills the socket and begins to form a clot. This clot serves as a protective barrier, covering the underlying nerves and bone. It also provides a foundation to lay down new bone and heal the soft tissue. In case of premature loss of this clot, the underlying nerve and bone are exposed. This causes intense pain, not only in the socket but also radiating all along the nerve, just 24 to 72 hours after extraction. It also causes inflammation of the socket, which causes localized pain and swelling. This painful condition, where the socket is devoid of its contents, is called dry socket. If the clot is retained post-extraction, the normal healing process takes place. From day 1 up to 3 weeks, initial angiogenesis takes place, forming a framework for bone formation. By 4 weeks, new bone starts forming on this framework. By 6 weeks, rapid bone growth begins and continues until the socket is closed. After this, the bone begins to reorganize and becomes hard and mature at around 4 months post-extraction with complete soft tissue healing. Some pain and swelling post-extraction are normal. It usually subsides with the help of over-the-counter pain medication or that prescribed by your doctor. Some signs and symptoms of dry socket are severe pain and inflammation, exposed bone at the extraction site, complete or partial loss of the clot, and halitosis or bad breath and foul taste in the mouth. The exact cause of dry socket is still under research. However, bacterial contamination and trauma during or after extraction are said to be the most probable causes. Let us look at some things you should avoid post-dental extraction or risk factors for developing dry socket. Smoking. It slows the healing by contaminating the wound. The act of smoking causes formation of negative pressure in the mouth, which can dislodge the clot. Hence, all forms of smoking should be avoided. Rinsing the mouth and spitting may cause loss of the clot and should be avoided for 24 to 48 hours post-extraction. Use of a straw is another thing that should be avoided for at least 2 days, as the act of sucking can cause dislodgement of the clot. Frequently replacing the gauze pads used immediately after extraction pulls out the clot prematurely and should be avoided at all costs. On the day post-extraction, no strenuous exercise should be performed as it increases the risk of clot dissolution. Gum disease increases the chance of other infections. That is why good oral hygiene should be maintained throughout, that is, before as well as after the extraction. Consumption of hard, sticky foods, if consumed shortly after extraction, can pull out the clot, leading to dry socket. Complications of dry socket are extremely rare. If left untreated for a long duration of time, it can lead to a bone infection called osteomyelitis. To prevent dry socket, it is highly recommended that you maintain good oral hygiene throughout by brushing with a fluoridated toothpaste at least twice a day. The best preventive measure is rinsing the mouth gently with warm salt water at least twice a day. It is important to remember that both brushing and rinsing should be done only after 24 hours of extraction and not before that. I hope this video has taught you something about your incredible body. Do share this with every dental patient you know. For more such fun, educational videos, do subscribe to our channel.